Now, if you're deaf, having access to a British Sign Language interpreter can be crucial, especially when trying to use the NHS. But a BBC investigation has found support for deaf patients in the health service is failing to meet the standards required by law in some areas of England.
1 in 3 adults in the UK are deaf, having hearing loss or tinnitus. In 2016, the Accessible Information Standard was introduced in England, which gave all people with a sensory loss, impairment or disability the legal right to have their medical access needs met in a way that worked for them. But
a Freedom of Information request has revealed this isn't always the case. 202 NHS trusts were contacted in England and 145 responded. In the worst performing trust, just under a quarter of BSL interpreter requests were fulfilled, and only 2 trusts had full-time interpreters.
So we're joined now by people who've experienced this firsthand, Kate Boddy and Dr. Justine Durno, alongside BSL interpreters Linda Bruce and Ray Williams. Welcome to everyone.
Thank you.
Dr. Justine, do you want to explain a little bit about how this works in practice, where the problems lie? Because this is something you deal with in your practice.
It's a system issue. Some people think it's only a small amount of people who are affected, but it's over 9 million estimated in the UK and England. So they think, oh, it's only a small amount of people that are affected, but actually there's lots of people that contribute to this and who are affected by all the barriers that are put up. So they become at the bottom of priority lists. So the NHS is a bit outdated. So, for example, they heavily rely on telephones calls. They often phone the patient with test results, but that person can't pick up the phone and speak or hear those results. Or they may send a letter with the contact details. Again, it's only a telephone number, so expecting that deaf person to ring. So every step of that process, they're always facing different barriers. So it's a recurring theme of misdiagnosis, late treatment, low standards of treatment. So there's a wealth of information out there that, you know, online, but this information is not accessible for deaf people. So it means that they can't understand what their conditions are. So that deaf person has a higher rate of things like high blood pressure, high cholesterol, more diabetes, but they're not sort of thinking about those people, thinking about their healthy lives. So it's a big cost to that deaf person, and you know, and also it can be life or death situations. So it's estimated the cost is 30 million to the NHS through missed appointments and wrong treatment.
And in fact, Kate, your dad's case is a very good example of what Justine has been describing there. And he was quite a trailblazer, wasn't he, in the deaf community himself?
Yeah, he really was. My father, I melt when I talk about him because he was such a lovely guy. He was born profoundly deaf. His first language was sign language, so that was his main and preferred method of communication. So he couldn't read very well, and he couldn't read or write English very well, but this is not common for deaf people of his age and demographic. Despite this, he was an aircraft technician for 45 years. He was a teacher, and he was an advocate for deaf people.
What's he doing there?
Having fun with the grandchildren, which was one of his pleasures.
And tell us a bit more about the problems, the practical problems he faced and how it impacted him.
So my father experienced floaters in his vision in early 2022, and he went to a high street opticians to try and get help with that. He went into the opticians and asked for an interpreter because he wanted to explain that he was having these symptoms, and they stated that they were not willing to provide the interpreter. Unfortunately, they missed the fact that he had a detached retina, which caused him blindness. And then we went to a GP. The GP said it's going to take 2 weeks for us to get you an interpreter. So again, I had to do a telephone consultation. They sent us to another optician. Again, there was no interpreter there. Who then sent us on to a hospital. There was no interpreter there. Who sent us on to a second hospital. There was no interpreter there, and I interpreted all those interactions whilst very late on in my pregnancy. Had to tell my dad that he had cancer. He only got an interpreter very last minute when the operation was due to happen, because I phoned round interpreters and made that happen, because I was saying to them, look, I'm due to give birth. I can't interpret this, and you need to get consent by an independent interpreter, and that's when it happened. Unfortunately, following that experience, even though we made complaints, he was denied access to BSL interpreters through further high street opticians, private hospitals. He had an inpatient stay in our local hospital when we contacted the spoken language agency who were responsible for providing interpreters, and they would not provide us an interpreter.
Justine, I think that's a terrible situation, but I know you in your own life have experienced similar inadequacies within the system. What is the issue? Is it a lack of understanding from managers? Is it a lack of available interpreters? What's going on here?
Oh, there's so many things, and costs and the systems. It's a lack of deaf awareness. If I wasn't deaf myself, I wouldn't know about how to communicate with a deaf person. It's a lack of funding. The NHS is really stretched, and we're working, behind, and we're responding to people's needs, So like I said before, the assumption is that there's only a small population of deaf people, but they are people, and they deserve, and they have rights. They need to have equal care. There's no reputable system in place for booking interpreters, and some people don't even know how to do it. It's more easier for spoken languages, but for BSL interpreters, they just don't know how to do it. So everything is fragmented.
Justine, can I just, the NHS, we've got a statement from the NHS who've said all NHS services have a legal duty of care to provide clear communication so patients and their families or carers can fully understand everything they need to about their treatment and care. NHS England remains committed to meeting its responsibilities, accessible information standards. So you read that and you think there are laws, that you have rights and you have laws, but as I think your story illustrates, in practice, that doesn't mean much. You can know the law and you can know your rights, but there's no one in the room with you.
Yeah. And Dad's story isn't a rare story or a rare occurrence. Every deaf person I know has a story about wanting to access healthcare and their rights not being met.
Even myself. I'm a doctor, and I've got experience, and I can see that lack of equality for me. Sometimes I've walked out of a hospital appointment because the attitude towards me being deaf has been absolutely awful. And the NHS is, when we're looking at when it started, when it's established, in 2022, they did a review to see, if things are being implemented. But I think it's only 11% of the responses to the survey said we have equality. We have quality healthcare.
When you say, Justine, the attitude is awful, what is that? What's actually happening? What is it you see when that happens?
The nurse called me by my middle name, so I ignored what was being said. And then I explained that this was my name, and she said, "Oh, you've got hearing aids. You should be able to hear me." And it making these assumptions of what I can and can't hear. So when I left, I just rebooked the appointment. And the nurse phoned again saying, so she needs an interpreter. But on a one-to-one basis, I can communicate quite well. So there's a lot of assumptions of what I can and can't do and what I can cope with.
It shouldn't be that you have to move to fit the needs of the NHS. The NHS should be moving to you, and I can see that it's probably exhausting having to constantly come up against these obstacles, and this is repeated millions of times over, as you've told us. But I guess in recognition of your wonderful dad, you would love to see now people really take this on and implement change.
We've been fighting for this for years, and there's been lots of consultations with hospital and healthcare providers. We've relayed the issues that the deaf community are having, but there seems to be no real change. So we're hoping that this news coverage will make that change.
What would you seek? I mean, I suppose the obvious thing to say is more interpreters being available. Is it that simple? I mean, is it that
It's
simple?
not that simple. No. Would you say it's that simple? No.
No, every deaf person is unique for what they need. Some people may need or prefer have somebody that they could lip read. Some people may want an interpreter. Other people might communicate by writing things down. So the NHS is the first step. Their first step is to ask that person what they need as soon as they arrive, and then record it, whether it's an interpreter, and making sure that it's quite clear that for example, you know, when we go to a GP, they shout the name through a tannoy. Maybe if the GP came out of their room to call the person in. So it's depending on the deaf person as they are. Everybody's unique.
Yeah, I'm still slightly reeling from the notion that the NHS would offer a deaf person a telephone consultation.
It happens all the time.
Right. It's been really interesting hearing your stories. Thank you for sharing your story about your father. And yeah, we'll follow this with interest and see what, if anything, changes. Thank you.
Thank you.
Thank you for having us.
Thanks so much.